listening to the Agent Survival Guide podcast, a podcast for today's insurance agents. Informing, educating, empowering, improving the way you do business in an industry that's anything but static.
In today's episode, D-SNPs. You've heard of them. You may even be thinking about selling them. But there's more to them than just being eligible for both Medicare and Medicaid. We've got answers to the whats, the hows, and the whys for selling dual eligible special needs plans. The Beginner's Guide to D-SNP, written by Roxanne Anderson. Whether you're new to D-SNPs or searching for information to fine-tune your selling techniques, this episode of the Agent Survival Guide will cover all the critical details you need to know about these valuable, multifaceted products. Before we delve too deep into the tips and tricks of selling D-SNP plans, let's set the scene a little bit. What exactly are D-SNPs? D-SNPs stand for Dual Eligible Special Needs Plans and are a type of Medicare Advantage, or MA, Special Needs Plan, or SNP or SNP. Each state determines which D-SNPs a carrier can offer and the benefits they can include. Generally speaking, D-SNPs include the following: care coordination, $0 monthly premiums, over-the-counter quarterly benefits, dental, vision, and hearing benefits, transportation benefits, gym memberships and wellness programs, and telehealth services. So, who qualifies for D-SNP plans? The short answer is that individuals of any age who are eligible for both Medicare and Medicaid qualify for D-SNPs. They are often called dual eligibles. So, how do you get to be eligible for both? For Medicare, individuals must be 65 years or older or have a qualifying disability. To be eligible for Medicaid, an individual's income and asset levels must fall below certain thresholds determined by their state. A little side note here for our agents listening. Remember, always verify a client's Medicaid eligibility before enrolling him or her in a D-SNP. Many D-SNP carriers have agent support personnel who can assist you with this task. The type of plan a dual eligible can enroll in depends upon the Medicaid category they fall under and the plans available in your service area. Many join a D-SNP plan through default enrollment, when an individual may be automatically enrolled into a D-SNP when they are on Medicaid and become newly eligible for Medicare, and the individual is in a Medicaid MMCO affiliated with the D-SNP. Individuals must receive a notice of the upcoming enrollment at least 60 days before it will occur, and have the opportunity to opt out. Like other types of Medicaid Advantage plans, there are different types of D-SNPs. There are 3 different criteria used to categorize D-SNPs: their network, the Medicaid levels they serve, and their level of integration with Medicaid. Let's start with PPO versus HMO D-SNPs. When categorizing D-SNPs by network, there are 2 categories: Health Maintenance Organization, or HMO, and Preferred Provider Organization, or PPO. Most D-SNPs are HMOs, so we'll start there. HMO plans require beneficiaries to use in-network providers for all non-emergency services. They also require beneficiaries to elect a primary care physician and get referrals for specialists. HMOs are typically associated with lower out-of-pocket costs. HMO plans can be beneficial to those who qualify for the D-SNPs because often these clients value lower out-of-pocket costs, are looking for plans with access to strong provider networks, and are okay with network restrictions. Next, we have PPO. This type of plan has a network of providers but will cover beneficiaries for services received out of the network. Beneficiaries typically pay more for using out-of-network providers, but PPOs typically don't require the election of a primary care physician or referrals to see a specialist. Beneficiaries typically pay more for using out-of-network providers, but PPOs typically don't require the election of a primary care physician or referrals to see a specialist. PPO plans can be beneficial to those who qualify for D-SNPs, value a flexible network, and are willing to spend a little more out of pocket if needed to get the coverage they want. Not only can you differentiate D-SNPs by HMO and PPO, there are also two different types of coverage, full and partial D-SNPs. The different D-SNP coverages are based on Medicaid levels. Full benefit dual eligible, or FBDE, Medicare zero cost sharing, dual eligible subset, and dual eligible subset Medicare zero cost sharing. Partial D-SNPs may accept individuals who fall into the following Medicaid categories: Medicaid zero cost sharing, dual eligible subset, or dual eligible subset Medicare zero cost sharing. The type of enrollees they accept varies based on the plan. Let's start with the full benefit dual eligible SNPs first. To be eligible to enroll in this type of SNP, dual eligibles must qualify for full Medicaid benefits for the month under any eligible category or medical assistance for any month if the individual was eligible for assistance in any part of the month. They must also be enrolled or in the process of enrolling in the Medicaid Managed Care Organization, or MMCO. Medicaid eligibility categories include full benefit dual eligibles, Qualified Medicare Beneficiary Plus, or QMB Plus, and Specified Low-Income Medicare Beneficiary Plus, or SLMB Plus. Next up is the Medicare cost-sharing type of D-SNP. Dual eligibles who aren't responsible for cost-sharing for Medicare Parts A and B can enroll in this type of plan. Medicaid eligibility categories include Qualified Medicare Beneficiary, or QMB, and Qualified Medicare Beneficiary Plus, or QMB Plus. The third type of D-SNPs that are based on Medicaid levels is dual eligible subsets. These are members of certain groups of dual eligibles determined by a carrier's coordination with a state Medicaid agency. Medicaid eligibility categories for the dual eligible subset include Full Benefit Dual Eligibles, or FBDE, Qualified Medicare Beneficiaries, or QMB, Qualified Medicare Beneficiary Plus, QMB Plus, Specified Low-Income Medicare Beneficiary, or SLMB, Specified Low-Income Medicare Beneficiary Plus, SLMB, Qualifying Individual, or QI, and Qualifying Disabled and Working Individuals, QDWI. The final D-SNP type in this category is Dual Eligible Subset Medicare Zero Cost Sharing. Enrollment is open to members of certain groups of dual eligibles who aren't responsible for Medicare cost sharing. These groups are determined by a carrier's coordination with a state Medicaid agency. Enrollees qualifying for Medicaid in the Full Benefit Dual Eligibles, or FBDE, Qualified Medicare Beneficiary, QMB, Qualified Medicare Beneficiary Plus, QMB Plus, Specified Low-Income Medicare Beneficiary, SLMB, Specified Low-Income Medicare Beneficiary Plus, SLMB Plus, Qualifying Individual, QI, and Qualifying Disabled and Working Individuals, QDWI categories are eligible to enroll in the Dual Eligible Subset Medicare Zero Cost Sharing SNP. Effective January 1st, 2027, parent organizations that operate an affiliated Medicaid plan in a region may only offer one full benefit dual eligible special needs plan there. They may, however, offer additional SNPs for partial dual eligibles in the same area. Some D-SNPs coordinate with their state's Medicaid program to different extents. Whether these plans integrate with the state programs and how they work with the programs can influence a handful of factors. We refer to these as integrated and non-integrated D-SNPs. There are several structures for D-SNP plans. D-SNP plans can be fully integrated, highly integrated, coordination only, or applicable integrated plans. Because these plans can widely vary in structure and benefits, we strongly suggest reading the version of this blog post. The text version includes helpful charts to break down the differences between these plans to make it easy to understand. The link to that post will be in the episode notes below. As part of CMS's 2025 Medicare final ruling, starting in 2027, CMS will limit enrollment into certain D-SNP plans to individuals also enrolled in or in the process of enrolling in an affiliated MMCO. To further enforce care and benefit coordination, CMS is requiring that by 2030, D-SNPs with an affiliated MMCO will have to disenroll any dual-eligible individuals who are not already enrolled in the MMCO. We've identified a lot of important aspects about the D-SNP: what it is, Medicaid eligibility, who can enroll. Now, let's talk about when agents can sell D-SNPs. Similar to other Medicare Advantage plans, you can sell D-SNPs to someone in their initial coverage election period, or the ICEP, the annual enrollment period, or AEP, or the Medicare Advantage Open Enrollment Period, or the MAOEP, if they qualify. When someone becomes eligible for an integrated D-SNP, they qualify for a Special Enrollment Period, or SEP, to join one. As long as they maintain their eligibility for Medicare and Medicaid, they have an SEP to elect an integrated D-SNP once during each month. Let's take a deeper look at these enrollment periods, starting with the ICEP. Individuals may make one change within the 3 months prior to enrolling in Medicare Parts A and B, and either the last day of the month before enrolling in Parts A and B, or the last day of the Part B initial enrollment period, whichever is later. The only exception? Full benefit dually eligible individuals in an MMCO cannot select misaligned D-SNPs where applicable. What about during the AEP? If an individual is dual eligible, they can make one change during the AEP window, October 15th to December 7th. The exception to this ruling is full benefit dual eligibles in MMCOs who cannot select misaligned D-SNPs where applicable. If your client is looking to switch during the Medicare Advantage OEP, they're allowed a single change from January 1st to March 31st. Once again, there is an exception that full benefit dually eligible individuals in MMCOs cannot select misaligned D-SNPs where applicable. For the special enrollment period for electing a FIDE SNP, HIDE SNP, or AIP as eligible mid-year individuals who are full benefit dual eligibles can make one change per month only to facilitate aligned enrollment. Finally, there is no longer an SEP for electing a non-integrated D-SNP as eligible in the mid-year, ever since contract year 2025. Now that you know when to enroll individuals and who qualifies, you may be wondering where you can start finding these D-SNP prospects. Thankfully, they are all around you, especially if you work near an urban or generally low-income area. If you sell near a large rural area, it may be more difficult to find prospects because CMS won't allow D-SNPs in counties that don't have a certain number of doctors. It may also be difficult to get clients if you do business near moderately to highly wealthy areas, since the type of prospects you're looking for may not be able to afford living there. Since welfare programs and Social Security disperse payments near the beginning of the month, you should be able to attract D-SNP prospects in places where dual eligibles spend money during the first half of the month. During the second half of the month, you should be able to attract them at places where dual eligibles seek assistance. For example, during the first half of the month, try places like dollar stores like Dollar Tree, Dollar General, or Family Dollar, discount stores like Walmart, Ollie's Bargain Outlet, or Big Lots, or thrift shops and flea markets. During the second half of the month, try visiting food pantries, food banks, or soup kitchens. Throughout the month, you can try peppering in a few visits to places like utility assistance locations, community and charity events, churches or other faith-based organizations, areas with low-income housing, or senior centers and retirement communities. While you cannot scout potential clients, you can host a compliant Medicare educational or sales event or leave compliant promotional materials where D-SNP prospects might go. These actions can help you stand out as a resource in your community for D-SNP prospects to come to you. Be creative and split your time at different locations. While these locations may help you find potential clients who may qualify and be interested in D-SNP plans, you need to seal the deal and build your D-SNP business. To achieve this, you'll want to focus your efforts on two main objectives: utilizing grassroots marketing and providing superior customer service. Taking a grassroots marketing approach is the most effective way to get D-SNP leads and build your D-SNP client base. Grassroots marketing involves going out into the community where prospective clients are, engaging with them, as well as forming relationships with other professionals in the community who can refer prospective clients to you. This could include visiting community centers, retirement communities, and other areas with low-income housing, hanging tear-off flyers or business cards on bulletin boards at indoor flea markets, thrift stores, or churches, forming partnerships with churches, provider offices, nonprofit organizations, and retailers, setting up your own booth at community events, or holding educational and sales events. According to one of our agents who found success in the D-SNP market, grassroots marketing gets you closer to your community on a deeper level and builds loyalty. Folks in the D-SNP market are many times looking for help, and if you've been on the ground with them in their community, building their trust, they're more likely to work with you. Before moving on, it's very important that I note you must follow all CMS Medicare Advantage and Part D communication requirements for marketing these plans and holding events. Compliance violations are no joke. They can get you in trouble and shatter the trust you've worked so hard to foster in the community. For more information on how to stay compliant, check out the links in our episode notes. Of course, becoming a part of the community pairs well with the other piece of advice that will help you stand out in the industry, providing superior customer service. Treating people right will increase your chances of converting prospects into clients, getting referrals from existing clients or professionals within your community, and retaining clients. You can provide superior customer service by becoming well-informed on the subjects you hear prospects and their clients asking questions about, educating your prospects and clients on their health insurance programs and options, making sure your clients understand their plans and benefits and how to access their care, and letting your prospects or clients know about other people or programs that can help them with their non-health insurance related needs when appropriate. Now, you might be wondering how to retain D-SNP clients, and that's fair given the nature of D-SNP enrollment. The fact that dual eligibles may be able to join or switch D-SNPs mid-year can be a double-edged sword. On one hand, it gives you the opportunity to find new MA clients anytime throughout the year. On the other hand, it gives other agents the opportunity to swoop in. In order to avoid losing your D-SNP clients, ensure you establish trust with them. Be someone they know that they can come to with health insurance questions. Provide them with superior customer service. The job isn't done once your client is enrolled. Do everything you can to help them while maintaining a professional relationship, and communicate effectively in person and digitally. Confirm they know how to best reach you when they have a question. Give them your phone number and email address. Here's a pro tip. Fridge magnets are harder to lose than business cards. Follow up with them within the first 30 and 90 days, and then every 6 months to 1 year after. Check how they're doing, if their income or prescription drug needs have changed, and if they've used the extra benefits like dental, vision, or over-the-counter medication allowances. These actions can help you build client loyalty. Don't forget, the smallest of efforts can make a huge difference in the lives and minds of others. We've covered the whats, the hows, the whens, and the whos of D-SNPs. You may have noticed there's an important part missing still. Why is it a good idea for you to be selling D-SNPs? You've learned that selling D-SNPs can earn commissions during Medicare's off-season. But there's one point we need to make clear. If you're only interested in selling these products for your own profit, you may quickly find that you're not working in the right market. Out in the field, you may encounter many people confused about their health insurance options. Your ability to explain things in an easy-to-understand manner and effectively answer their questions might be tested. Simply put, agents who sell D-SNPs do so because they truly want to help others through their business. You should sell them if you want to do the same. Contracting with D-SNPs can open the door to many new opportunities for your insurance business. To learn more about these products or to find out which ones are the most competitive near you, reach out to us at asgpodcast@ritterim.com or by leaving a voicemail at 717-562-7211. That's asgpodcast@ritterim.com or by leaving a voicemail at 717-562-7211. Thank you for listening, and we'll see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written by Roxanne Anderson. Script adaptation by Tina Lamoureux and Jeff Snyder. Recording and production by me, Jeff Snyder. Podcast design by Urban Rivera and artwork by Vivian Zhou. Rate and review our show on Apple or Spotify.